Bengisu Bassoy. I'm one of the pediatric STAs, and my project is about SHO-led prolonged jaundice clinic in the pediatric department. So a very quick background about the prolonged jaundice. It's basically visible jaundice persistent beyond the day 14 on the term babies and day 21 on the premature babies. It is most common reason is the breastfeeding, but it's a diagnosis of exclusion, especially for the biliary atresia and hypothyroidism. So it's a big burden for the pediatric assessment units, especially during the busy periods. So previously the all GP referrals coming via hot clinic, and then the consultants see the patient within 24 to 48 hours, or the registrar, and then we approximately has 2 to 3 referrals per week from the GPs for the investigation of the prolonged jaundice. So my aim is to improve the availability of the hot clinic slots by removing all the prolonged jaundice patients from the clinic by June 2017. So when I was working on the previous hospital, I noticed that those prolonged jaundice patients has been seen by the nurse-led clinics and not for the consultant. So I thought it would be a good opportunity to improve the hot clinic slot, because I'm also aware of it. And waiting time for our hot clinic slots, so it's sometimes more than a week. So it's ideally it should be 24 to 48 hours. So my expected increase in available hot clinic slot is by 30%, which will also make an extra income to the department by 20%, which is around £470 per week. The current situation on our hot clinic is, so you can see from the graph that, so during the June, July, August time, there is a drop on the hot clinic referrals, but it is still roughly between 2 to 4 referrals, which we only have 2 referrals per day. So it's gone up significantly around the winter time. So you can see from the January, February, and March, it is the 6 referrals per day. So you can see all of them, you know, they're a little bit more details with which days are more busiest, so which days are a bit more available. But overall, as you can notice, it's roughly 4 patients per day is the referral for the hot clinic slots. So my project is to prolong jaundice patients run by the clinics, run by the SHO. So between 9 to 9:20, it's only 20-minute slots in the outpatient department. So there is a fixed pro forma for SHO to fill, and then on the pro forma also blood tests documented. They are all done under the indirect observation with the PAU consultants. The result will be available in afternoon time. So the consultant will also receive the result in 24-hour period on their office. And then that result will be discussed with the PAU consultants in terms of action needed. And then the PAU consultant will write a letter to GPs and parents about the result. So the current progress, so what I did, I contacted other local hospitals to asking their service, prolonged jaundice service. One of them was Leicester Royal, which they built up a really nice ongoing service about the prolonged jaundice patient. I contacted them. I have got their the ideas and then the way that they work. I performed the pro forma based on the NICE recommendation, and all the pro forma has been approved by our consultants. And I've spoken to all of our SHOs. I made a very brief training with them about how to fill the pro forma and what to look for specifically for the prolonged jaundice patients, because some of them are quite experienced. They don't need much information, but some of them are just the GP trainees. They just need a little bit extra information. So far, clinic started in June 2017. This is the 3rd week of the clinic is running, so with a really good and steady progress. So first week we have seen 2 patients. Second week I thought that there will be 3 patients, but the patient cancelled on Friday, so it's only 2 patients has been seen last week. So there is another patient coming tomorrow. So I'm working on the information leaflet to be given to parents. So we are working on that leaflet. So it's in the progress. So what I learned from my experience, I have attended a couple of meetings with my consultants for approval of my pro forma. and also the management team meetings, so which I found quite useful for myself. So just being involved with the management team, how to set up a new project, it was all the good experience. And I also become familiarized with the clinic coding and income details. There were a couple of things which I had no idea, but what I understand that management team take that ones really seriously, like where this patient needs to be seen, clinic coding. For me, as long as any small corner should do the jobs, but in terms of where they are coming, I think change the incomes. So this is the reason we set up the children outpatient department. So I thought that I can implement my project within a couple of weeks, but it took nearly a couple of months. So I didn't notice that implementing any project in NHS, it takes longer than expectation. So regularly, since the project has been implemented, I'm assessing the situation nearly daily basis, and I'm getting feedback from the consultants and also SHOs, and making do some adjustment on the the current clinic settings. So for my future evaluation, the daily basis, I'm getting feedback from SHOs and consultants when they see the patient, see whether the system is running smoothly. I'm glad that we started on June time. As you can remember from the graph, that June is the quietest period for the pediatric department. So hopefully the clinic will be up and running nicely and securely around the winter time, when there is the busy period hits. After the June-July time, I'm planning to gather all the data from clinic coding about the availability of the hot clinic slot to see the improvement. But I'm expecting the better improvement during the winter time actually. So, and then I'll see the improvement effect.